Awesome. Welcome, guys. This is the Second Opinion Sports Medicine Podcast. I'm Dr. Dhokal.
I'm Dr. Glass.
And we are on Zoom today, chilling. Dustin, you're at your house, I assume?
Yes, sir. Yeah, it's comfortable right now. It's been a little rainy here. I'm sure down there too. You're not that far.
No. Yeah.
So got a little break from the rain, but it's kind of nice to come home and just hunker down. Yeah, kind of miss our in-person combos too. So
yeah, no, it's good. We'll have those again next week or the week after when time permits and situations permit. But we can't complain too much about the weather when it rains like 18 days a year here.
Right.
We had a couple this last week, and it was nice. I feel like it cleaned the air up a little bit, and it's a good change of pace from the Southern California weather that we're used to, where it's always the same pretty much.
Yep,
Yeah.
definitely.
Yeah, well, what's good this week, man? How's the last 7 days been for you?
Yeah, so just thinking over the weekend, we had a little birthday party for one of our neighbors, so it was kind of good to see just get out of the house and do something different. Went to a nice restaurant locally, a steakhouse, and yeah, so it was good. It was good to just kind of do something out of the norm and hang out with neighbors outside of just seeing them around town. And yeah, so that was kind of good, something different.
Just even stepping out to a dinner with friends is like such an underrated thing. It's quality time with good people.
Yep.
And it's just fun to change the routine up and be out and people watch a little bit. It's a good time.
Yeah, for sure.
Yeah.
How about you?
I think on the upside, I got to see some family this last week. I went up to the Bay Area again this last weekend. We had some family stuff. So I got to see my cousins, see my family, spend some quality time with everybody. And that's always good. So that's kind of my appreciation of the week is I have a large family. So we don't always get to spend time together. People are off doing their own things now that everyone's older. People have their own families and stuff. But for birthdays and major events, we all come together, whether it's a graduation or a moment of sorrow or sadness or something. And it makes me just appreciate my family in particular, and just relationships in general. So I was driving back. It's a long drive, and I had a few thoughts of just my relationships, like friendships with people like yourself, and just the connections we have doing what we do in the medical field, being able to help people. And a lot of people come through your office, and to have those relationships is, I don't want to take that for granted, but sometimes in the busyness of life, like you kind of forget. So I was reminded this weekend, and that's what's good on my end. I got to see family, and it's just good to kind of get those reminders every so often to be grateful, right?
Yep. Kind of a reset for sure.
A reset, no doubt. Yeah. But yeah, I was didn't catch too many games this weekend because I was commuting down. I watched a few kind of before, during, and after travel. But did you watch anything in particular that caught your eye game-wise?
Well, the Ram game was pretty exciting.
Who they play this weekend?
Actually, the didn't go good for the Rams, but they played Tampa Bay.
Oh, Tampa Bay, that's right.
The
Yeah.
Tampa Bay game, yeah. So it was fun at the end watching Brady do his thing. It was
That's right.
crazy. We were in and out of the game, watching the game, and then towards the end, and then to see Brady's eyes, they zoomed in, and you knew like, oh, he's got this. And it was fun to watch him turn it on like that. And the way just each play they meticulously just drove down the field, and it was just, I think everybody in the stadium knew what was going to happen.
Yeah.
So it was fun to watch.
Press conference afterwards was what I saw before the drive. And so I saw him come to the presser and get to the podium and say, that was effing awesome,
Yeah.
And then I was like, man, I got to really watch what he was so hyped about, because he doesn't get hyped like that too often.
Right.
I mean, he gets excited and he's animated for sure. But then I watched how they won the game afterwards. And yeah, it was pretty impressive.
Yeah. Yep. That's what all these years of experience get you. He's been there so many times, and when you're in that situation, and Kobe had a famous quote, and I'm going to butcher it, but when you practice and you do it so often, it shouldn't surprise you when it happens.
When you
Basically,
execute.
what he's
Yeah.
saying, yeah, because he's like, why would I, when you see me calm and when you see me, confident in those moments, is because I've done it a million times before, whether in my
Yeah.
head or in action. And so by the time I'm having to produce, it's a no-brainer. I just let my body take over. And I'm sure Brady, he's done it so many times. I forget what the stat was of how many fourth quarter, within 2-minute drives he's had wins like that, but it was like 50 or 60. It was ridiculous. So
That's awesome. I think
yeah.
that's great. I was talking with some friends and family this weekend about, how people respond under pressure, and it's like fight, flight, or sometimes freeze, and if you've been in those situations before, then you have a much more higher, success rate. And for certain people, they thrive in being in that situation, so, somebody was saying, well, if I had a free throw under pressure, I'm going to execute at the same percentage rate as if it didn't matter.
Right.
And my comment was, certain people actually under pressure execute higher than their normal average, right?
Mhm.
And so that's just another level. Some people thrive under the pressure or can really hone in and focus in those pressure moments. And Tom Brady obviously is one of those guys. I don't need to. That's not breaking news, but pretty cool to watch when he has that opportunity, right?
Yeah, yeah, for sure. And I kind of take that mentality a lot of times into my patient cases too. When I'm working with new patients or anybody for that matter, and we're trying to get to the point across, like, we want to get you, I don't want to just get you out of pain. I want to get you survival ready, right? Are you game ready? And when I'm talking to the average person, their game ready is their everyday life, right? And so that's we talk about that on a regular basis. Why should you do your homework every single day? Well, you need to be prepared every single day for a game. You got to be game
Yeah,
ready. And I
that's
said,
smart,
whether
right?
that's lifting, a flat of waters out of the, trunk,
Hmm.
whether that's, stepping up on a, retaining wall, whether that's in the middle of a mall that's going crazy because there's an emergency and you have to run out, how are you going to survive? So and as soon as you start putting that in their mode, like, it's not okay just to be able to touch your toes right now. Can
Right.
you can you roll around on the ground? Can you jump over something? Can you do this? So I pride myself in getting my patients game ready for life, and because I always say, like, I have a sliding glass window in my treatment room that looks out to a little patio and a wall. I said, if there was a fire or a raging bull came through this office,
Did you get over
and
that?
and we had to get over that, there's no doubt we would get over there. But how would you be on the other end? Like,
Hmm.
what is that side going to look like? Are you going to be laying there? Are you going to get up and limp away? Are you going to be, and I always say, I said, if you had to be a hero, would you rather walk in the parade or be wheeled in the parade, right? So
Right.
when it comes down to it, you will be able to get the job done typically because adrenaline will kick in. But I want you to be thriving, not just surviving, right? So,
A
so
100%.
talking about this, mentality that Brady has, Kobe has, it could be equated to, or, everyday life. People can work on that kind of mentality.
Well, I think it's tough too to turn it on and off. I think you can. I think I have moments of extreme focus and moments of chill. And people that are always hyper focused or always just trying to squeeze the most out of every moment, that takes focus and practice. And I admire people who can do that all the time. I'm not quite at that level, I would say, but it's one of those things, like, if you don't, if you're trying to be excellent in practice or excellent at your craft, but you don't care if you're mediocre in all other aspects of life, I would say that that's going to leak into what you're trying to be great at, and it's going to affect your greatness,
Mhm.
hinder it. And so, yeah, I think it's important to, if you're trying to be great at something, whether it's your craft, your athletic skill, whether it's, what you're studying, then you should be accountable in other aspects of life. And I think that's only a realization I had, you know, as an adult, right? I think when we first met and we were in school, I was trying to be above average or great at a few things, and I never thought of it in the manner of, man, you should really try to be great in everything you do, um, because that just as a principle leaks into other aspects of your life, right?
Yep.
Uh, so for whatever reason, I know that now and I appreciate it, but I didn't then try to tell other people who are younger who, are interested in stuff like this, like,
Mhm.
hey, if I had, what I know now 10 years ago, isn't that what everybody always says,
Yeah.
right? So,
Yeah.
yeah, so man, that's good. Well, how's the family doing? How's everything else with your daughters and sports and stuff?
Yeah, everything's going good. My this weekend was asked to put on my coaching shoes again and help my 14-year daughter's team coach. The other coaches were in Vegas coaching the older girls, so I had to help out with the younger. So that was kind of fun. So we just had a little couple game friendly with the other uh, parent team. So
Yeah.
that was fun. And then that same day, in the end of the day, watched my daughter play soccer, and they destroyed a team from LA. I think it was 12-0 by the end of the game. And these are club level girl. I mean, it was a lot of
Yeah,
fun, but for us, and my
for
daughter
sure.
played lights out. And then my daughter from Tennessee just sent me a text, a video of her receiving her um, college glove today, with the embroidered emblem on it with her last name and number on
Oh,
it.
very
And so
cool.
that was really cool. Yeah, to see.
Very cool.
Yeah, it's big league for her. So that was fun.
Yeah.
Yeah.
So
How about
proud
you?
dad.
Yeah, of course.
Um,
The family
yeah,
good?
yeah. Everyone's good on that tip. This weekend we were having a little back and forth because in this week's games we have the Chargers playing the Niners, and as you know, I have some family in the Bay. We went to school in San Jose, so one of the first docs that I met that I thought had a cool job was the chiropractor for the 49ers, and I was like, man, that guy has the job, and I worked at his clinic for a little bit, and I remember asking him, and he was like, you might want to find another team because I'm not leaving this post anytime soon.
Yeah.
um, so yeah, there's been a lot of banter back and forth about some football stuff on a sports medicine related topic. So my cousins, I have a few side bets, and I'm a little bit worried because we made those bets early on in the season, and now going into this game, the 49ers have acquired Christian McCaffrey, which we spoke about last week. The Chargers are without Mike Williams. They're without their starting left tackle. They're without Keenan Allen. And so, there's a few men down going into this matchup. So I might owe some dinners and some cash, maybe a Venmo transfer or two at the end of this week. But I'm keeping my fingers crossed that, we can pull that game out. But yeah, so injuries, really affecting how teams come in and are able to play at full strength or not. The Philadelphia Eagles, are undefeated. They have a game coming up this week uh, that we'll see if they stay undefeated or not. And you know, I had a few people ask me about high ankle sprains this week because of Mike Williams in particular. There was a few other high ankle sprains, so maybe later on we could touch base on why that takes so long to heal. We discussed that last week a bit, but you know, I did have two or three people ask me about that this week, and so maybe we could just reiterate kind of the nuances of that and why something might take 4 weeks versus 8 weeks, 10 weeks, 12 weeks. Um, but you did briefly mention you had a couple cases about, was it somebody's hand or had some injury or of some sort?
Yeah, well, just looking through the injury reports, I was surprised at how many hand injuries there have been. The one that kind of sparked the interest was, um, who was it? I have it written. The Giants DB, Xavier McKinney.
Hmm.
Um, Interesting. He made the news because he ended up, reportedly on the bye week, rolled an ATV or was on an ATV that rolled. He said they
Oh,
were doing some sightseeing and there was nothing reckless about it.
yeah.
So rolled it, and ended up fracturing three fingers in his hand.
Oh
So
man.
Yeah, so kind of a bummer from a sports medicine. That's just a no-no, like you can't be doing anything outside of, unfortunately this
Especially
was
in
an
season.
accident. Hopefully it was just an accident. Hopefully he wasn't doing anything stupid that set him up to have that happen, because
Right.
that just is a most contracts have in their clause, you can't get injured doing, you can't do anything else. You can't play rec basketball. You can't be doing, put yourself at a position to have this happen.
Let's
So
talk about that, Dustin, because
yeah,
you being on the inside, having worked for several teams, you probably know a little bit more of the nuances. I know from my perspective, there's definitely things where you're like, hey man, that you got to wait till the off season to do that if you're going to, definitely not in season. And I've had a few examples of just clients that I treated that were thinking about doing XYZ either during the bye week or just during the week. Um, and once or twice where like one instance in particular, I can think of somebody who turned his ankle, and it was like the narrative was, I did this in practice early, I rolled it, and what had really happened was, he was in the nightclub the night before and was just, hanging out. It wasn't a big drinking situation. They weren't drinking, but happened to slip and turn his ankle in the nightclub. And he was a client of mine, so told me that. And obviously we kept that between us. But I thought it was interesting that when he went to work the next day, he's like, oh man, so it was, for fear of maybe getting in trouble or, being out when he wasn't supposed to, but that's not being on an ATV, right? So
right.
he said hopefully he wasn't popping wheelies, and those things are dangerous. I had one since I was a kid. I've definitely flipped one or two in my time. And so uh, I could see how it could happen even if you're not being reckless. So benefit of the doubt. But
Yeah.
yeah, what does the team say? What can you do and not do? Because I think a lot of people think you're an athlete, you can just kind of
Yeah.
live life.
Yeah, well, and I'm limited to what, I'm privy to, but most of the time, the contracts are written individually with each guy, and their agents are handling it, and then the teams overseeing it, and then they come to an agreement. But almost all of them have a clause in there what says you can and cannot do during the season,
Mhm.
depending on the sport too. But most all the sports, it's just a blanketed, during season you are owned by us basically, and it is, eat sleep and whatever your sport, you're expected to report healthy. If you
Yeah.
don't, then either lost pay, or I've had a couple of baseball players that I know of that, leading up to spring ball, reporting, um one was a basketball issue, just played a little pickup game,
Mhm.
rolled, and they rehabbed it enough, but by the time he got to camp, they told him, Don't even unpack your bags."
Yeah.
So yeah, and
An ankle. It was an ankle issue.
this was a knee.
Oh, knee. Damn.
Yeah, so but they just pretty much told him, "Listen, we gave you one," and that basically they did. They gave him one job. All you have to do is stay healthy during the summer and show up healthy. Other than that, you're good. And he couldn't do that. So it was more based on principle for them, was
Sure.
like, "Listen, you
You
couldn't
can't
even
be
follow,
trusted.
yeah, you couldn't even follow one rule to stay healthy. You put yourself at jeopardy, and this would happen." So even though you can come in, and this is, like I said, a top prospect that knew he could play, and the team knew he could play, but they didn't want to deal with it. So it's a bummer. And then another was an ankle baseball guy, same thing. Um, they told him to turn around too.
Yeah.
So, but yeah, but during the season, you hear a lot of stories like that. Me being inside the facilities, um, you really, it's kind of, they don't talk about, if it is from outside, like you said, you're going to hear more being an independent than
Yeah.
I'm going to hear being inside, because inside everything's documented, so
Yeah. It's pretty
um
rare. It's not like it's a frequent thing where guys are
yeah,
out wiling out or going crazy. For the most part, it's go to work, and by the time you get off work, it's the end of the day.
yeah,
It is a full time, everyday type of situation. And
yeah,
I think, on a side note, I think that's why maybe a lot of athletes have trouble when they get out of their respective leagues, because I know at least with the NFL, it is militarily like regimented,
Yeah.
in other words, like everything's accounted for, whether
Mhm.
it's treatment in the morning, meetings at this time, practice, weights, film, whatever it is. And it's continuous. And I think guys get used to that and they like it. I know I like it just on a
Mhm.
very basic level of games Mondays or Sundays and then
Yeah.
Tuesday off days. And then I think it's tough when you don't have
Yeah.
that kind of tough, regimented schedule. So
Yeah.
uh, yeah.
But
So,
But I want, this hand thing, I want to talk a little about just for the listeners to know, like, people don't realize how many bones are in your hand. You got 27 bones in your hand. Okay.
yeah.
So, and you got three per finger. So, and then, so that's 12 plus the two on the thumb. So you got 14 bones there. So when you crush it, and he had three fingers fractured, right? Or three fingers that needed surgery on it.
Wow.
So we're assuming that he had, some, and you only do surgery when there's some deformity typically, that can't be really, relocated, like a dislocated finger that needs to be relocated. So if there's been some tissue damage in the ligaments, the tissue break through the skin, like we've talked about compounds, um,
Mhm.
or if it affects the joint. So that's another thing I think the listeners need to know. When somebody gets a hand surgery, it typically is because it's affected the joint at that point. It's not just in part of the longer, the bone. It's actually affected the joint. So at that point, they typically have to go in and pin it, 1 to 2 pins per area. So
I'm glad
it,
you touched base on that because I think that is, like that's a question people have if they get injured is like, well, is this going am I going to be able to rehab it? Is it going to need surgery? Are they going to need to put in hardware?
yeah,
And maybe if you're a professional athlete, you maybe get the hardware because you want to recover quicker, perhaps, or to have the least amount of deficiency after that thing heals.
yeah.
So
Well, yeah, like the deformity. You can't catch a ball or throw a ball very well with a finger that's, not moving or deformed. It's
right,
going to throw off everything. And so, like in his case, three, that's pretty significant. I think I'm pretty sure, he's a defensive guy, so he could tape that up. It's a little different. He can bat the ball down, a
yeah,
lot easier, make the tackles. But
you can
for
do
a
like a
receiver,
stretch.
yeah, so for a receiver that needs that tactile feel, quarterback, it's a little different story. That what they do is they go in and pin it, and then so after a couple weeks, then they'll go and take the stitches out, and then after like 3 to up to 8 weeks, then they'll actually take the pins out again. So the recovery time, takes a while because it's a relatively basic pin removal that they do. They don't have to lace it up again. They just kind of they have a way to just pull it straight out. It's pretty gnarly, but um, it's pretty
Still
non.
healing after that, though, right? There's still
Yeah,
healing after that. So
anytime you're puncturing the skin, there's going to be an inflammatory and a healing process. So, which takes a few weeks. So, when people hear these hand, like, who was it? I wrote it down. Just this week or last week, the Bengals cornerback, um, um, uh, Mike Hilton,
mhm,
versus the Browns, fractured his pinky, and he elected. So he sat out and elected. But the crazy thing was, he broke it second quarter and played through it
gotcha.
throughout the rest of the game, and nobody knew. And then he ended up having surgery on it the next week.
That it's gloved and taped, and you're
Yeah,
like, let me just
yeah,
rock with it.
yeah. Probably didn't know the extent of it. He had three fractures in that one pinky.
Ooh,
That's crazy, right?
yeah, that's
So
tough. You would think, a little hairline, maybe you're like, I jammed it,
yeah,
I can play through it. You kind of, you're careful when you're tackling, you're not grabbing jerseys. Three fractures, though, that's aggressive.
right. Second
Yeah,
quarter and still played the through it. So
good
that
for
just
him.
goes to show what these guys do. A lot of people don't realize, they see, I had to dig in some information for that, but from face value, it just says, oh, he was out the week, and for surgery on his pinky. It doesn't
Yeah,
tell you what it was all about. Three fractures. Then you look back, played the whole half, with it. It just these guys, this is their craft. And like we were talking about concussions, they want to be in there, they want to be there playing with their boys, playing for their team. And who was it? I might butcher it. Was it Ronnie Lott that cut off his pinky to play,
100%. I was going to mention that. Yep.
to play in the Super Bowl, right? So,
I'm
or
not even sure it was the Super Bowl, Dustin. I think it was maybe just a playoff game. I got to kind of reread that lore, but I was a 49er fan when that happened. And, that was kind of like playground talk. I was like, did you hear Ronnie Lott, what he did?
yeah,
That's definitely, probably wouldn't go on today, but,
yeah,
that
no.
was a
So,
different era.
but thinking of that pinky, 3 fractures, back in the day, he might have elected just to cut it off versus missing a week, who knows? So anyway, so yeah, he had that. Carson Wentz, his ring finger. So,
Hmm.
that was one recently that he had his surgically
Right.
repaired. And then
Is he?
Dak Prescott's, we all know about Dak's, and we could kind of, now looking at it, we could see how fast his recovered. His was pinned at the joint right above the thumb.
Yeah.
And after a couple weeks, he was already, getting back into it kind of. So I
I'm
think it just,
impressed with that. I'm impressed with the surgeon. I'm impressed with the team training staff and the rehab, and his dedication to get back. Because even though all three of those are hand injuries, if you're playing defensive back, like you said, it's different. If you're playing defensive end or nose tackle, probably club it up, and maybe that's an advantage as you
yeah,
hit somebody. As a defensive back, you want that dexterity, you want that mobility. However, you can play without maybe as much of that if you're a receiver, So I could see how he could get away with it, but getting to my point with Dak having that thumb surgery on the proximal part of his thumb, that's all grip, right? So that's grip strength, and you need that grip strength to throw. We'll talk about another quarterback who has an injury here later on, and some of the mechanics of the throwing motion. But that's what I was most impressed with Dak is, one, how quickly he recovered, to your point, and two, there's probably at least a half a dozen people working on that one thumb joint, if not more, to try to get him back. And that's what's impressive to me. I was watching his throws and how if the ball looked loose or if it looked tight, and
Mhm.
spinning it again, so
Yeah.
that's impressive.
Yeah, that recovery is kind of crazy because just like any other injury, especially soft tissue, we got to get that inflammation down because inflammation is part of the healing process. But it also, if it's lingering too long, one, the pain, but two, the instability and more loss of function. So when
Right.
we're trying to, get something functional, we need to get that inflammation down. So, and then we got to get the mobility, especially in the fingers and hands. We got to work on each little joint, like each little joint, if it's the tip of the finger, the most distal joint, we're just doing little soft tissue and getting joint mobs in that little guy. The same with the
True.
pinky, and we'll just be working on. You said that, as a team of people working on that one thumb, that one pinky, we're doing soft tissue. We're doing Groston with the tools, or with the rock blades. We're doing instrument assisted, tool work. Then, one team I worked with, one pro football team I worked with, we for one hand guy, and I know it's common for a lot, but we used paraffin baths for it, which was really cool. That was the first time, that was probably almost 20 years ago now, that I first saw that, and since then have used it. But I thought that was really cool. That moist heat in there that traps it
Yeah.
in, and it felt
I
really good to the athlete.
have a cool little side story about that since you brought that up. About maybe a decade ago or so, I had an older patient who has since moved out of the country, but she had arthritis in her hands and she used to knit a lot. And I just thought she was a grandma who knit. And
Mhm.
she actually knit as like a career and like made these intricate, ornate, you know, big pieces. But now she just liked to do what she, her hobby, and she couldn't do it. So that was something that had helped her. And excuse me, we use that just for her. The paraffin bath on her hands, and it helped with her arthritis. And then that same, relatively in the same time, I had a wide receiver that jammed his thumb, jammed a couple fingers, all in the same season. he recovered from that, but he'd always be like, man, P, my hand is so achy, like it hurts. Like it had the mobility again after a few weeks. The swelling had gone down, but joint pain was there. And because of the older lady who was like dang near retired, I said, I got this thing in my office. I'm gonna bring it over next time. We should use it. And the first time he used it, he's like, this is the coolest thing ever. This immediately is like, it feels so good. Like, can I get this in my gloves somehow? And I
Yeah.
was like, no, but you can do it more often. So it was an instance where, an old lady with arthritis in her hand, that connection, actually helped a 20-something-year-old wide receiver in the NFL, so same therapy, just as effective,
Yeah.
so
And for
uh,
the listeners, it's the paraffin bath is basically where we heat up wax in this container, and it's liquefied, and then they stick their hand in or their foot or whatever, and then when they pull it out, the room temperature kind of solidifies the wax around the hand or the joint or whatever. Yeah,
around maybe.
all as high as they can get it, and basically it traps some warmth in there, and it's just really soothing and feels really good. I've been told they use it at for manicures and pedicures at the salons. I don't know.
You're not fancy enough to go, is that what you're
Yeah,
saying?
I've not done that. I
Yeah,
know a lot of my athletes go, but
yeah.
I've never joined.
Treat yourself, man. Treat yourself.
Yeah, I heard it's good. I heard it's nice, but
That's
so
fun.
yeah, so that's cool. And then after another thing, once the hands getting more mobile, one of the nice treatments I've used in our office and some of the facilities is using big old rice buckets to just get your hand in and you just twist through and get as deep. One of my buddies I used to work with out of his facility, huge training facility, he worked on a lot of MMA guys, and that's where I first saw it. And they had a big old trash barrel full of rice, and they would go all the way up to their forearm, just having to dig different directions, different gripping in, and really strengthened all the little intrinsic muscles around those hands and forearms. So we've used that so it's another good tool for people to know about. Um, and the rice that I found works the best is from Costco, the rose
Really?
rice. Yeah, it's a big old 20 pound bag of rose rice. It
I'm
works.
gonna tell my dad that he's works in the rice industry up in Northern California, and
Okay.
I'm gonna have to tell him and be like, hey, Dad, I'm gonna need to hook up on the rice so I can
Yeah,
make a little therapy product.
there you go.
He's gonna find that interesting. But no, I can see that working for sure. Um, you know, you talked about small intrinsic muscles, and I think that's something that's often neglected, right? Like we use our hands every day. People like wide receivers obviously use their hands every day. Quarterbacks use their hands every day. Pitchers, um, et cetera, et cetera. A lot of the times we don't think that our hands need work, right? It's like my shoulder hurts, my elbow hurts, my knee hurts. Rarely do we give the hands the proactive care that they need. And I don't always work on people's hands when I do body work, but if you're a receiver, I'll spend time and we'll work on it. And I'm always amazed at what feels tight to me and what feels therapeutic to the person. So one of my favorite things, since I use my hands all the time, is if somebody's working on my hands, that feels really good. And it's um, one of those things where you don't realize how tight it is till somebody works on you.
Mhm.
So I think it's important. And the small intrinsic muscles, like you said, have a tendency to become really tight from repetitive motion if you're just sitting like this all day, or you use your hands in a specific way, like that patient who was always knitting, she had repetitive motion. And those intrinsic muscles can become weak or spastic and tight or inflamed, often neglected. Around the ankle, since we talked about high ankle sprains last week, I often use the foam board, the balance board, to build up those small intrinsic muscles.
Mhm.
So I really like that rice idea. And the paraffin was a good reminder as well, just because that's so soothing.
Mhm.
Yeah.
Yeah, for sure.
I had somebody a couple weeks ago who had a thumb injury, and I asked, how many bones are in your hand, do you think? And he said five. And I said, that's a good guess because, obviously like what you would guess. But yeah, I think, just like you mentioned the other day about ankles and the number of bones and ligaments in your feet, your hands and feet are critical, right, to everything that we do, and often neglected. But a lot can go wrong in there, and when you injure it, then hopefully it's not something that affects you on the day to day. But how can it not?
Mhm.
It's like one of those things you take for granted until you jam a finger and you're like, man, it hurts to brush my teeth. I can't open this jar. All these small things. I can't grab my steering wheel and drive.
Yeah.
So, yeah, did you have somebody come into the office recently with any hand issue?
I did. I'm trying to think because I used the rice and I told him, and now I can't remember what it was. Yeah, it was last week,
Yeah.
but I know it's important, and I think it was a chronic issue that we were trying to work on. Oh, actually, I had a police officer get in a little scuffle,
Hmm.
and the person he was wrestling with actually kicked at him. They were on the ground, kicked
Okay.
at him, and took his thumb all the way back, and it blew up. Um, and so we were talking about rehabbing and recovering on that and what to do next steps. Obviously, he was going through work comp, but he was picking my brain.
Did
So
you
that was
dislocate it or break it?
no, it just went all the way back. Bad sprain strain. Yeah, it was bad. So um
No, that's terrible.
a good way to piss off a cop even
For
more.
sure. Yeah.
Yeah.
That's
But
terrible.
yeah, but he was recovering really quick after a couple. But one thing on fingers too, a lot of people another I got a picture from a quarterback. That's a good so that was another thing. So you're jogging my memory. I got a picture from a dad. The quarterback sent me a picture up past LA's way, and
Mhm.
the tip was totally off to the side. Totally just the tip of his
Off the
finger.
lateral.
I forget which finger it was, but totally, totally, totally 90 degrees. And
What happened? What was the method of injury there?
um, the text was, and I didn't get into it because it was between. All he asked was, "Can I fix this?" So that's all he wanted to know. And I told him, I said,
That's funny.
yeah, I said first we need to get X-rays. We need to, go through. This is a quarterback I've seen for a number of things, and I'm the first go-to for him. And I
Yeah.
told him, I said we need to get X-rays on that. We need to know if there's a break. We need to know if there's a torn ligament. If it's just dislocated, we can work with that a little. We can do get it to relocate. But I told him those things take forever. When there's tissue damage, when there's ligament damage, it's one of the hardest things to correct that distal, phalange like that. So I felt bad telling him, but I said, get that information first and then call me. But the first thing we check for is circulation and with the capillary refill. For people that don't know that, you squeeze the tip of the nail, make sure, it comes back. The coloring comes back after it blanches away within a few seconds. And then numbness and tingling. Those are the first thing. If those are there, then that's what we consider an emergency. We got to go get that because there might be some vascular or nerve compromise. I had one in high school. Oh, I got my finger caught in a guy's face mask, and the guy jerked his head to the side, and it dislocated my ring finger. And since then, I can never, my knuckles never been the same. The trainer relocated on the field, but I never rehabbed it back then. So one of the things I always talk to my patients about, man, you got to take care of it, even if you're tough and you can deal with it, and it's not that big a deal because it's just your finger. Especially, the guys, they think
On down the line.
oh yeah, and it's always a chronic thing. I can't, I can. My wife's happy. I can never take off my ring now.
I was going to
Yeah,
say the same thing.
yeah.
I said,
So
did Leanne put somebody up to that? Like, hey,
right. So,
bust
but
that finger.
chronic arthritis, and it's just, it's just not what you want 20 years from when you had it, right? One thing when you're 15, 16, 18, but when you're 30s, 40s, 50, that's not what you want to be dealing with. So take those
No,
little
it's a
things
good
serious.
point.
Yeah.
Absolutely. I think if we took as good a care as our on our bodies as we did our cars, we'd be okay. I know people that, any little scratch they get fixed right away, or, they're always polishing things or making sure their tires are rotated. Their cars are
Yeah.
perfect, right? But for your own body, you're like, oh, I'll put anything in it. I'll eat anything, garbage, whatever you give me, something tasty, whether it's good or bad. And then beyond that, if you get dinged up, you get a dent, you get a ache, you get a something, you get it just good enough and not as good as it was.
Yeah.
And then you have a problem. Maybe not then, but at some point in time that catches up to you.
Yeah.
I have a couple of those myself, and I think I mentioned in an earlier podcast, one of my good friends, Vaughn, he mentioned something that's just stuck with me with my ACL rehab. And he's like, hey, man, like, you know, you can rehab as hard as you want, but you'll never be able to rehab, as hard as you can in week one, week two, or week three, or week five. There's importance to those early days, first weeks, first months. You can't go back. You can rehab, in retrospect, I would have rehabbed, from day one to month six, even minimally would have been better than rehabbing super aggressively starting month six. Lost all that time, right? And so, to your point, it's important to take care of those little things before they catch up. We're trying to live a long time, so we don't want something 40 years down the road to,
Yeah.
be bothersome every day. That's annoying.
Yeah. Talk about old injuries. I know you've dealt with this, and I know we had a recent quarterback deal with it, but tell me a little about UCL injuries.
Yeah, so this last week, I think most people who are NFL fans saw that Josh Allen, the Bills being in first place in the AFC, he had what's called a UCL injury, ulnar collateral ligament injury. For the layman, it's an elbow injury, right? And you're like, what kind of elbow injury? Is it broken? Is it torn? It's not broken. That ligament injury could be a tear. It could be a sprain strain. It could be just irritated and inflamed. So there's a lot of things that can go on there. In this particular instance, the quarterback, Josh Allen, went to throw, and as he was coming forward to throw, he had somebody hit him in the arm. So it was like a strip sack situation. And so I think if I recall, he got hit like kind of lower arm, not up by the hand. And so uh, he was quickly decelerated as he was trying to accelerate his arm forward. Basically, his arm got hit as he was throwing. Um, you know, what I would commonly call like an elbow sprain, and so you can sprain it in different areas. In this instance, in your lower hand, you have two main bones. You have your ulna, your radius, the ulna on the pinky side, radius on the thumb side. When you rotate your arm, this is called pronation. This is called supination, hand up. So as you supinate and pronate, those two, your radius and ulna, also rotate there in that joint area. And so that ulnar collateral ligaments on the inside of the elbow right here. And, in Josh Allen's case, he's actually had that injury before. I think his rookie year was 2018, and he had the same injury then as well. I think he missed 4 or 5 games. I probably should have looked it up, but if I go by my memory, I think he missed like a half a dozen games or part of the season, and he came back from it. So yeah, it'll be interesting to see this weekend. He plays the Vikings, so 6-2 Bills versus the 7-1 Vikings going into Week 10 of the NFL season. Also, cheers to episode 10 of our podcast here.
Yep.
And yeah, I mean, it sounds like it'll be week to week. At least that's what the team said. They said, he didn't practice on Wednesday, probably be limited in practice, I imagine. It's kind of a rest and rest and see situation. I can speak on when I had the injury. Obviously, it's not as serious as someone who's playing for an NFL team, and you're drastically a different team without Josh Allen if you have your backup in there. And so I'm sure all Bills fans and people who play fantasy and maybe gamble on the sport perhaps are, watching the injury reports. But it's something you can play with if it's not bad. It's something that can put you out if you're a quarterback, absolutely, because it, deals with acceleration and the throwing motion, the mechanics of that. So
Yeah, it's kind of the equivalent to the knee. It's kind of the equivalent to the MCL, the medial collateral ligament, where
yeah,
it
yeah,
protects the valgus force. So where in the knee, if you get a blow from the outside, it protects the inside of your knee. Same with the UCL. It's basically protecting that inside of the elbow from, and the hand from kind of being that tweaked lever, so that what they call valgus stress. So that's why it's important, because it's a stabilizer. It's one of the, stabilizers on the inside of the elbow. um, I saw a clip of it, and I also saw at one point him him shake out his arm, so which as somebody that's, so the Tommy Johns on that UCL is really I mean, in baseball, when a pitcher or somebody has that injury, they typically talk about the Tommy John surgery.
that's
That's
something most people have heard and are familiar with. Yeah, right.
correct. So for the listeners, if they don't know, that's basically the same kind of thing that we're talking about. Really, with baseball, that supination and pronation, like you were talking about, with repetition over and over and over, it just kind of gets strained. And with those forceful, certain pitches will have a different effect depending on how much supination or pronation
That's
is.
a good point too, right? Because I did it like this, but
Yeah,
when you're throwing,
yeah.
obviously you have that motion happening, right? Where you have the rotation of the arm, and that's torque on the elbow directly.
Exactly. So that's kind of where, because we don't hear about it so much in football, because that throwing motion, you're not pronating as much as you are. There is pronation in it. If we slow it down, you'll see it come through.
Mhm.
But in order to get that spiral, you're not. It's a more of a wrist action than like a curveball, or
Right.
So, anyways, but one thing I found interesting, having had that in little league, we call it little leaguer's elbow,
Yeah,
when
good
I was a pitcher growing up, going through it, I had a lot of elbow. And one thing I know, typically I never shook out my hand when I was injuring that ligament. I do shake out my hand when I hit my funny bone,
point.
and I get my nerve irritated. So, so that's what I'm kind of curious to see what comes out of this. If he actually ends up playing, and has no more talk about the UCL, I'm going to speculate that it was more of an ulnar nerve
Mhm.
irritation than ulnar collateral ligament issue, because to shake the arm like that, and it could have been both, right? He could have
Right.
got, like you said, got caught up right there, hit that ulnar nerve, caused it to, shoot
Right.
vibrating nerve pain throughout that hand. He shakes it out, but the aftermath, you got a contusion on the nerve, and you got a sprain, or a strain you don't know, or a sprain ligament you're not sure at the moment, so they have to let it calm down. If it's the nerve, that's going to clear out a lot faster than the ligament typically, if it's just a contusion. But yeah, so it'll be
Yeah, no, it's good.
something I kind of was in my head going, wonder which one it was. Once the dust settles, we'll have a little better idea based on how fast his recovery is. Because like we've all hit our funny bone, which
Yeah,
is when you hit your funny bone, what you're feeling is that ulnar nerve being hit. And
yeah,
so that's what makes you shake out your hand. If he did that, we all know we're not out for 3 weeks with that. It's a couple hours, maybe a day or two if we hit it really
exactly.
hard.
Right.
But if you roll your ankle, you're out for a few weeks maybe. Same with if you have a sprain strain of your elbow, you're going to be out a little longer than if it's just a bump on the elbow. So it'll be interesting. So something I thought about.
I had two thoughts while you were talking. One, pretty observant of you, because I watched, I didn't watch the game live. I looked up, see if I could find the video clip of the injury or the mechanics of how it happened. I always like to see in real time how something happened, and then also, if possible, in slow motion. just to kind of break down the biomechanics and just looking at different things. And so I thought it was pretty cool that you were like, man, I noticed he was shaking his arm out, because I had the same thought of, if you got hit like this, okay, he probably maybe hurt that UCL, but also maybe stretched that ulnar nerve in there, and that's why he was shaking his hand out or had that. Interestingly enough, I don't remember having any like grip strength issues with it, but I do remember having a lot of, pain when throwing, right? I also don't remember it affecting my accuracy. I do remember it affecting my velocity, if
Mhm.
that makes sense.
Yeah.
So when I was really trying to whip it like on a deep out or something on the opposite side of the field, I kind of knew that sucker was going to sting,
Yeah.
and it did. It hurt,
Mhm.
and that's when you're like, like kind of this, but it didn't affect my grip strength. So if you're like carrying a bag of groceries or something like that, you're probably not going to feel it. If you play catch with your son, or you're an NFL quarterback and you're throwing something, that's the motion where you're going to really, where it's going to light you up. So I'd be interested to see. I'm not so concerned if he plays on if his accuracy is diminished. Um, what I would assume is maybe he doesn't go as deep as frequently. Um, but saying that, his last throw of the game, I saw this, measured out at 69 point something yards. So, if he does have a UCL injury, he's not whipping it 70 yards on the last play of the game. And, they were trying to win that game on that long play. They lost to the Jets last weekend, probably in part due to his injury, and just the adaptation to an injury sometimes takes more than what you can do in game.
Right.
There might be strategy and play calling that's going to be different and altered going into this week's game against the Vikings, which is a big game. The 7-1 Vikings, 6-2 Bills. You're kind of like the upper echelon of the NFL right now, 10 weeks in, which I think is a good measure of merit. And you have enough data points to really see how things are shaking out. Do teams suck because of injury? Are teams really playing well because they have a weak schedule, or they're actually, dominating in some way, shape, or form? And so I'm curious to see how he plays. Like I said, I wouldn't expect him to lose any accuracy. I would expect him to maybe be calculated on his deep throws, or when he really has to, let it rip, right? So as a quarterback, you can throw it with touch, or you can really zing it. And, if you're injured a little bit, you can modify when you release the ball. Maybe you release it a little earlier to take some velocity off of it, but have it get there at the same exact time, at the same exact place. So I'm curious to see how he plays. I'll be watching the elbow, and also treatment wise, that's worth maybe pausing and discussing. I know what I would do in my office, but if I came in with an elbow injury, or a college, high school, pro level athlete came in with that, how would you start to treat that if this just happened to me yesterday, for instance?
Yeah, yesterday we're working on getting the inflammation down, so I'm going to use um, some in my office PMF, LAD, far infrared, stuff like that. Some modalities, some passive modalities to get the inflammation down without a lot of activity. Because right now the body wants to just kind of rest and recover. Don't want to put any more tension on that. I will start doing soft tissue on that forearm. I'll start working the muscles above and below, everything that crosses that joint
Yeah.
without actually moving that joint. So I can do a lot of flexor carpi ulnaris, the supinator pronator on that, and have them just work. I'd probably just stick passive, more massage, flushing out, but
Mhm.
working those lines, and then uh, um, the medial intermuscular septum is an area I like to work a lot. That's the little septum, almost like with the high ankle sprains, that connective tissue between the
Mhm.
tibia and the fibula, that connective tissue. The medial intermuscular septum is a connective tissue between the tricep and the bicep that a lot of times just gets gunked up when there's an injury like that, especially a contact injury, and it will bind down and not allow the bicep and tricep to move freely. So I like to get in on that a lot of times to separate those two before we actually start working on the bigger muscles. So that's kind of what I'm doing. And then I'm going to give them I'm definitely going to tape that area. And I have a decompression type technique that I use on that to kind of lift that skin off. And then I'm going to give them some home care on stuff to do. I'm going to suggest some nutritional supplements and some topical analgesics, some CBD topicals, anything to get the inflammation down from
Right.
a systemic side. Also, most topicals I recommend, I'll want to get a like a liposomal or a transdermal transmission to go right into the blood.
Why
Um,
don't you explain what that is? Because those are multi-syllable words, right?
Yeah, so trans so there's different delivery systems. How do you want to get the nutrient or the drug or whatever
Right.
into the area? Well, there's tons of cool stuff nowadays where we can deliver the nutrient right at the site without having to go through the digestive system. So I like to use liposomal means they take the nutrient and put it in this I don't want to get too technical, but it's basically like a little um ball.
Yeah.
And we can go into more details about how the water solute and how it all affects once it
That's
hits
meant
the
in
cell.
general,
But basically, it's like a little ball. It looks like a little ball. The nutrients inside the ball, when the ball hits the skin absorbs it right in and gets right into the bloodstream. And then the medicine or the nutrient is then delivered within the bloodstream right at that
Perfect.
site. So I tell my patients, everybody's heard of like testosterone cream or estrogen cream, hormone, therapy, replacement therapy.
Yeah.
It's basically the same delivery system that they use, but we can put an amino acid through there or whatever other substance we want, CBD through there, to get right in the bloodstream right at the site. So like any kind of ligament, elbows, ankles, any kind of thing like that, I have a company that we uses L-arginine and L-citrulline, two amino acids that actually help with vasodilation and help with uh, um, uh, releasing of nitric oxide and human growth hormone. And if we can do that right at the site right away, another passive thing, but it delivers tons of blood flow and oxygen to the area. And if it can stimulate a little natural human growth hormone, like it's going to stimulate anyways, but we
Right.
can help facilitate that using natural amino acids. Why
Be a
not?
catalyst. Yeah,
Right?
be a catalyst and accelerate it.
It's so cool. So again, for patients and athletes, day one of treatment, they feel like they're actually doing something for themselves versus just waiting till the inflammation goes down. So
100%. I'm a
yeah,
big,
so
big, big believer in that. And sometimes I've had people push back, like, those are all like little 1% things, like that's not going to solve the problem. It's like, well, okay, well,
yeah, do what you
okay,
want with it. Yeah,
what's your point? Like I'll take 10 1% gains because that's a 10% gain, you knucklehead, and like also making progress right away, I think is the way to go if you can, because it just accelerates everything else, right? So
yeah. Well, and
um,
plus, like I told my patients today, like I was talking to one of my teenage dancers today. I was like, I don't care what everybody else does. That's the norm. I want you to be better than that. I want you to be the one percenter.
yeah,
So that way, when they're all kind of crashing, you're thriving, right? So let's do what they don't do so we can have those gains and
yeah,
then have them wonder why they're left behind. So just because it's not normal, you should love that, like, okay, let's do what's not normal, you
yeah. I
know.
mean, you lose your, the way I look at it is you lose your, well, maybe that's not, I'll just say what I was going to say is you lose your competitive advantage once something becomes mainstream. And we're in the business of making things that aren't mainstream, especially if they're effective, especially if they're cost effective and effective, even more so, right? Especially if it's something that you can do at home and you don't need to come into the office, something that you can be proactive with, even better. So there's levels to it. And uh, I think it's important, like you mentioned, you can start on day one to start to make progress, to start to flush things out, to start to improve the situation and get it trending in the right direction, and
Yeah.
like take cupping for instance, or take kinesio tape, back before maybe Michael Phelps in the Olympics did cupping, athletes who did cupping compared to athletes who didn't, maybe you feel a little bit better. That's a competitive advantage, in my
Yeah.
opinion, you know?
Yeah.
So all these little things, like we were talking about the hand earlier, when I work with one of my wide receivers in particular, I'm working on that hand. He has big mitts, you know, and it's like you're catching a lot of balls off the jug machine in practice, you're breaking tackles, you're doing all this stuff. Your hands need some TLC. And
Mhm.
so doing that stuff before you need it, before you've jammed it, before you've sprained it, you know, maybe it's a feel good thing for the athlete. But I know as a practitioner, it's deeper than just a feel good thing. It's actually doing some good. You know, it's affecting change in that area.
Yeah.
Good.
Yeah. Well, I want to say one thing on that. Yeah. Yeah. With the liposomal or the transdermal delivery system, I don't want the listeners to think you're like placing little balls on your, thing. It's basically in a cream. You don't even
Yeah.
see them. So yeah, I just wanted to say that because
Yeah.
I was
It's
trying
like
to
a
paint a
sticker
picture.
patch,
Normally I
basically.
draw it out. Yeah.
Yeah. It's like a sticker patch that has medication in it. It drives the medication into the area.
Mhm.
Grant, think of taking an aspirin, where you have to take an aspirin or some over the counter pain reliever. You have to orally take it, have it digest, and then have it go through your whole system
Mhm.
before it has a positive effect on that achy knee.
Correct.
In comparison, you can take one of those patches and put it directly on the knee and push that medication or whatever that it may be
Mhm.
directly into this site, and it's faster and maybe more effective as well, perhaps.
Yep. So good.
Well, you know, you sent me an article today, Dustin. I wanted to talk about it with you because it had to do with what we spoke about a few weeks ago, a few episodes ago, back in our single digit days, single digit episode days, now that we're double digit.
Yeah. Woo.
We were talking about injuries, and I think I forget who brought it up, but we were talking about, you know, are there more injuries on turf? Are there more injuries on grass? Is grass better? I felt like I wish every stadium was grass, just for the nostalgia, for the frozen turf in January, for the, you know, muddy fields in the fall in different parts of the country. It affects the game, obviously. Also, the argument could be made that you know, creates more injuries because of the unstable surface or variability there. What did you find in that article that you sent me?
Yeah, so I found it interesting. I think that was when we were first talking about a lot of the ACL injuries that were happening, and we kind of, hey, why are we seeing so many injuries? Maybe it's due to the turf, maybe it's due to and we had kind of a discussion of what we thought maybe was going on. But today I was looking through and just put on the injury reports, and this article came up with it. It was like 45 minutes old, and it caught my attention, and it was basically a recent study came out regarding the effect. I forget how, and you might have it, but basically was talking about the difference between turf and grass and the injury rates, and the comparison, and was one worse than the other. And the bottom line with this study was that there was no statistical difference in injury rates for non-contact injuries when it came to whether it was on grass or turf. And what I said, okay, well, maybe that's just, statistically, somebody's taken some random stats. But what I found interesting with the article was how they determine that. I guess the NFL Players Association does their own independent studies to protect the players, which I thought was really cool. I know with concussions and stuff, we talked about the Players Association jumping in and making sure, but they do it across the board for all, and so they're monitoring all these injuries, and they're seeing everything we're seeing, especially the last 2 years, the rise of ankles and knees
Yeah,
from non-contact injuries, and so I guess like we were talking about, they started looking into it too. No surprise, they want to know what's going on, and their independent researchers determined that there was no statistical difference between grass and turf. And I thought, man, that's pretty cool because that's unbiased at that point. They're the Players Association, they're trying to come up with an argument why one's better than that. And when
Yeah.
their own people are saying, nope, we can't find that,
So
that was
just for clarification, this was the Players Association. This wasn't the NFL that did this study.
correct. So yes, so yep.
There's
So
a distinction there, right? That's like a pharmaceutical company doing their own study on their own drug and releasing that information. You're like, of course you're going to say it's not dangerous. You found one study out of 12 that was favorable. You shared that one study maybe.
yes.
So this is the Players Association that has maybe, I don't want to say they're looking to find something if it's there and then
Yeah.
advocate for the players, right?
To
So
protect them, yes.
to protect them, right?
So yeah, so I kind of that was nice and interesting to see. Still surprising. I mean, because everybody's looking to figure out why this is happening, and you know, I
Let's go
think I
down that
think
road just for a minute.
what's that?
So let's go down that road just for a minute. Like if somebody was to ask me, well, I thought turf maybe would cause more injuries. That might have been, I think I would probably lean that way, maybe 55-45, just because of, like I said, snow, mud, things like that. That creates injuries as well. In a
Mhm.
perfect world, a perfect grass field versus a turf field, I'd take a perfect grass field over the turf. But knowing this information that you just shared, there's other variables that could lead to the rise in injuries, and it doesn't have to be the field, right? It could be training methods. It could be
Yeah,
what are some other things?
I personally think, and again, this is my opinion. And I have nothing to back this up, but just thinking it through and knowing how training works, I think I think it's there's not a standardized, because not every stadium has turf yet, and so some guys are playing majority of time on grass, or even if they're splitting time, and the turf might be a little different. I don't know, I haven't looked in if every stadium uses the same, they're contracted with the same turf guy. If
Yeah.
that's the case, then okay, we've taken that out of the equation, that yes, it's all the same. How's it prepared? I just think, I don't think they all train on the same um,
Surface.
surface. Thank you. Yeah, all the time. So you're gonna have different demographics based on weather, based on indoor, based on outdoor practice facilities. You're gonna experience. So you're gonna train your muscles, tendons, ligaments, joints to experience one type of thing, and then one week you're playing on this type, next week you're playing on this. It's very hard to be cross trained in that. So
Right.
you're going to be more susceptible to injuries, and it'd be very interesting to see if West Coast teams have these more issues, or East Coast team. You know what I'm saying? Like,
Yeah.
based on the weather, based on this. I think the only real way to get rid of that at some point is to have some standardized, everybody's on grass, and then you'd have to be like, everybody's on Bermuda, everybody's on whatever. I don't know what grasses are, but you know what
Sure.
I'm saying? All grass has to be the same. That way it's all equal. I
My pushback on that would be things are way better in 2022 and better probably since 2015 and beyond than they were in like the 90s. Places like the Astrodome, were just like you said, arena ball, where it was like thin carpet on top of concrete. And so, I don't see that as much these days, but
yeah,
I think there's more to come on that. I did think it was interesting that that study came out because, I would have assumed, if I was to take an educated guess, I would have assumed that that wouldn't have been the outcome. But that's interesting to know. It makes you then look deeper to, well, what could be some other causes?
mhm,
Because either it's just a weird anomaly and a coincidence and it's not a trend, or if it is a trend, then there's a cause for it, right? And since
yeah,
it's happening amongst all positions, it's not just wide receivers. And since it's happening amongst all teams, it's not just West Coast, East Coast, grass or turf. Yeah, there's more. There's something more there. So I'm going to keep marinating on it and seeing what comes about. If there's any other information this season or beyond.
yeah. Ask some of your current players too that are playing. if
Yeah,
they
I
have an
will.
opinion on it.
I
You
will
know,
for sure. I know one guy in particular hates playing on turf just because it's harder on his feet. It's not even a knees and hip issue. It's the cleats how they feel on the turf versus the cleats how they feel on a natural surface.
yeah.
So for his feet, he might have like a particular issue, but he says that he's way more sore on his feet post turf games than natural surface games. So I
Well,
thought that was interesting.
on that Titans player, Burks is coming back from a turf toe injury, so that's another one that people don't think about. That's basically where the ball of your foot, your big toe gets hyper extended. And so but repetitively, right?
Yeah,
Now with turf, that they call it turf toe, but it could be on grass, it could be on anything. You're it's that repetitive pushing off, and if there's not much give there, you're going to have more of a, you know, um, you're going to just be more susceptible to injury in that
yeah,
joint. So, um,
yeah. It's deceptively painful too. I'd like to expand on that particular condition, at a later date because I always thought like, man, it's just your toe. Like, what's the big deal? Until I got further along in my education, started working with, athletes that have this condition. I mean, you can't play with it. You just
yeah.
can't play with it, or if you do, you're drastically hindered in your movement and your explosion. And so we could break that down as well. But it's good to hear. So he's coming back off that injury,
Yeah.
huh?
Yep. So that's good. Yep. So, yeah,
That's cool.
which is nice because that one can take you out for a long time. Yeah, I definitely want to attack that
Revisit it.
one
Yeah.
or revisit it, because I have a good personal one on that with a basketball player, in the NBA. So we'll tell that story too.
Yeah. Let's maybe we could put that down for next week, perhaps.
Yeah.
Um, well, before we wrap up, I know we've been talking for a little bit, and you probably have an early jump tomorrow, as I do. I have a home visit early before I go into the office. But I wanted to touch base on next week's game. So we're going into week 10 of the NFL season. We have episode 10 of our podcast. So that's pretty exciting. And, we're about a little over the midway mark of the NFL season, not including playoffs. So there's a couple games I wanted to that jumped out at me. I go through the weekly games and kind of asterisk or highlight a few that are interesting, either due to injuries and how that might affect the games moving forward, or just, this is an interesting matchup. So the primetime games, Thursday night, we got the Falcons at the Panthers. Not too terribly exciting teams, I would say, this season. They're both pretty mediocre, but that's the Thursday night game. Sunday night football is Chargers, Niners. My old hometown team versus my current uh, favorite team, I should say, and that's next Sunday night. Should be a good game. Chargers are 5-3. The Niners are trending upwards, and not a division game for the Chargers, but I think that'll be an exciting one to watch in prime time. Any interest in that one for you?
No, they're sleepers. Both those teams. I don't give a shit. No,
Fair enough.
yeah,
Fair enough.
good. All good. No, I definitely want to watch that one.
Monday night we have the Commanders, Washington Commanders. I'm still getting used to saying that,
Yeah.
against the Philadelphia Eagles. I don't really have anything, miraculous or exciting to say about the Washington. I actually liked it when they called them the Washington football team, to be honest. I thought that was cooler. But I'm curious to see if the Eagles come out on prime time and win again and stay undefeated.
Yeah, I'm rooting for him now.
I'm going to go on record in week 10 and say that they're going to have a great season, but I could see them being one and done or ousted, before the NFC championship game, just because in football, especially, I don't know what it is, well, we saw the Patriots go undefeated until the Super Bowl, but that was a little bit of a different thing. But I think losing sometimes helps a team. It helps refocus the squad. A coach never wants a team to lose, but man, it's hard to run the tables, go and 17-0 in the season and then have a playoff game under pressure, especially if you've never been tested. These Eagles have I don't think they've been down in the second half at all. And so facing some adversity, seeing how your team rallies under pressure, how you perform, I think that's important. And so I'm curious to see how they do, but most NFL teams don't make a run deep into the playoffs and win it all. Most of them make it to the playoffs, suffer a loss, come back the next year, and then do better. And so uh, I do have a few friends that are Eagles fans that are kind of annoying, to be honest. And so if they get ousted in the playoffs early, um, I'm not rooting for that to happen. I always like to see a good story and a new team do well. But that's the Monday night game, so I'll get to watch them on prime time. Uh, we'll have it in the background as we're recording our next
Yeah.
podcast.
Yeah, I think they're gonna flip the switch and say, okay, we got to win it for Philly now, since they just lost for baseball. They're gonna.
Yeah, that's true too. That's a
So I
good,
think they're gonna use that, and try to
yeah,
rally.
that's a great point. Some other games of interest: the Cowboys and Packers. We didn't discuss them, but the Cowboys are 6-2. The Packers are 3-6 this year. Aaron Rodgers has a losing streak going on, and you know, for that rivalry, for the Cowboys to put it to the Packers, that'll be rivalry games are always good. So uh, I'm paying some attention to that. And then we spoke about the Vikings and the Bills with Josh Allen and his elbow injury. Is it going to be minimal? Is it going to be detrimental? TBD. One last game, a game in Germany. I don't know if you heard about this, but the NFL is going to Germany for the first time. They have a game this week, and it is the Tom Brady-led Tampa Bay Buccaneers versus the Geno Smith. That's right, Geno Smith-led Seattle Seahawks. And so they go to Germany. I had the privilege of going to London for a game with the Chargers. We played the Jaguars, I believe it was. And man, that was a fun trip to London. We had the bye week afterwards. I stayed in London for a few extra days, went to Paris. My then girlfriend, now wife, met me out there, and we had a good time. So I've been hoping that we have another international trip. It hasn't happened since, but pretty cool for the Bucks and the Seahawks to go kind of expand the NFL and play in Germany for the first time.
Yeah.
I did hear there's 3 million ticket requests for 65,000 total seats. So that's like mind blowing, right?
Whoa. Yeah, that's huge.
Yeah. So those are the games that I'm, looking forward to watching. Any of those jump out? Who do your Raiders play this week? I didn't.
I don't know. I've been checked out most of the week, so I didn't even look, to be
You're going to
honest.
say most of the season, my friend. Most of
Yeah, no, yeah, that's true too. That's true too.
the. That's funny. They play the Colts this weekend, actually.
Do
I
they?
think.
Okay.
So the Colts aren't super hot. The Raiders aren't super hot at the moment. Be good to see who kind of picks themselves off the mat and gets the W. Somebody has to win.
Somebody does. Yeah.
Well, not hopefully not a tie, but
Yeah.
usually somebody wins, right? Well, any highlights this week before we get off? Anything that you're looking forward to between now and Monday?
No, I'm looking forward to getting back to doing this in person, and yeah, each week's one day at a time.
Yeah. Some weeks are like that where it's you got to take it one day at a time because it's a bit of a grind or life is a little uphill. And I've had a one day at a time kind of mentality for a couple of weeks personally, but I always like to be in the office because it gives me. It's like for some people playing golf keeps them present. Being in the office also keeps me present.
Yep.
Makes me forget about other things, and so I look forward to a few more days of work in the office, and then a couple down days this weekend where I can recharge a bit and watch some good games and study up on some injuries.
Yep.
Yeah.
Sounds
Well, I
good.
appreciate your time tonight, Dustin. Thanks for meeting up and chit chatting about some injuries and some conditions and how we would treat it. I appreciate it as always. For our listeners, we thank you. You can subscribe to us or watch us on YouTube. You can follow us, listen to us on Spotify, Apple, or wherever podcasts, wherever you find your podcasts. And yeah, this is a Second Opinion Sports Medicine podcast.